Hello guys, welcome to my channel Something Interesting with Deepti. Today I'm going to talk about masks. In the ongoing pandemic, our first line of defense is a mask. So what kind of mask is better? Is it a cloth mask or a surgical mask? I have had my share of doubts. I'm sure many of you must have had your share of doubts. So I thought, why not talk about a mask today? So I went and met Dr. Kumar. He is the CEO of Medi Dent International. His organization is also into manufacturing of 3-ply surgical masks. So he is going to talk to us about the importance of wearing a right mask.
Surgical mask is 3-ply. There are 3 parts to it. The front part of it, which is water repellent, blood repellent, and the middle portion, which is the most important bit, which is the melt-blown filter. And then, of course, the inside, which is meant to be soft, hypoallergenic, and very comfortable to put on. Back here, as you can see, this is the team that puts these 3-ply masks together. The cloth masks do afford some form of protection, but a surgical mask is designed for example, dentists and doctors to prevent, as it's a very good barrier to ensure that a large amount of viruses and bacteria can't pass through. We're talking about a 99% if it's just front on. Now, a cloth mask doesn't do that. The problem with a cloth mask is that many people don't wash it. And if they wash it, they may not wash it properly, and after a while, it becomes minging. I mean, you need to take care of it, put it so that it's actually soaked with some form of soap to remove all the particles. And the long and short of it, it's actually quite hard to keep cloth mask at the same sort of the way you first got it and when you removed it from the wrapper. Whereas what we have over here is a surgical mask, which is individually wrapped. Okay, this is one of the packagings that we have over here. Of course, this is quite difficult for you to take on a day-to-day basis. You may want to have a few in your car, your bag. But what we have is the box of 50. In the box of 50, we have each pack of 10 is packed into one sachet, and that sachet can be torn. So the rest of the 40 masks that we have in here, they're all kept clean. For those people who are on the go and perhaps they want to have a bit more variance in what they carry the masks, and you can use a Ziploc bag. And Ziploc bag is obviously resealable, and these are the various SKUs or the ways we actually sell the mask. Now, I want to say to you, this mask is designed by a dentist. I'm a dentist. I'm also a medical doctor, as it so happens. As a medical doctor, the benefit of me understanding the specifications of surgical mask will improve the way we select the material, from the way it wraps itself on the face. Every component of the mask itself is crucial for me because as a practicing clinician, I look at it as if something I need to wear and be comfortable with, because I wear masks on a daily basis, pre-pandemic, of course. The mask that we have is extremely soft on the inside, and it's 99% bacterial filtration efficiency and 99% particle filtration efficiency, which also means that it conforms to the ASTM 3 or level 3 standards that the US has for the level of a surgical mask. So this is a medical mask. In Europe, they look at the type 2R specification. They mean exactly the same thing. There's a different grade, of course, how they view a surgical mask in both the US and UK. This mask that we have conforms to the highest level of specification for a surgical mask. As I said, this is not just a face mask, it is a medical surgical grade mask. Now, do we need a surgical grade mask as a civilian? Just remember what Mr. Lawrence Wong said, we need a high level of protection. You guys know that over just the last few weeks, we have seen cases of where people have just walked to open air areas and managed to contract the virus. It's like bystander damage, like cigarette dust to you. How crucial it is to have the right sort of face mask or covering that protects your face. We all know now that this is going to be an endemic problem, which means it's going to be here for our lives, and it's going to be around as far as I can foresee and as far as the WHO can foresee as well, which also means that we need to learn how to live with this. We currently live with things like the influenza virus. You may remember SARS. It's still around. You don't see much of it, but it's still around. I work in a dental clinic on a daily basis. We are experts in wearing the mask. I dare say that because we wear it every single day. I've seen patients Friends, wear the mask upside down. People who don't know how to use this properly, even this nose wire has not been attached properly to the front of the face and molded to fit snugly. Some of my nurses like to twist this at the side to improve the seal. Now, of course, an N95 protects us the best. We all know this. The N95 masks are not easy to wear. In fact, after wearing it for a while, you can feel that it's quite hard to breathe in. Not everyone is wearing protection the right way, the best sort of protection. Now, I'm not saying that this is the best mask in the world there is, but I certainly think that a surgical mask which is very easily accessible, and for you, if it's worn properly, and if it's 99% produced in a clean room environment, you now will have something that protects you. There's a higher chance you would not contract the virus in a place which is meant to be, think about it, an open air area, and people are contracting the COVID virus. So obviously we now we know it's airborne. We used to think it wasn't airborne. So I would certainly think some form of basic research would have been done by most people over the last 1 year. Everyone have looked up face masks. Everyone has been holding face masks at home before. Now, please look at what the HSA has got to say in Singapore. There are a few mask manufacturers in Singapore who have actually taken the trouble, gone through the licensing, gone through the ISO, gone from any form of conformity that we are required to do before our product gets legally licensed to be sold in Singapore. Now, I have you know, the Singapore government is quite strict in terms of what they will allow to be sold over here. But last year, they weren't able to, for a few reasons, of course. One, they needed a lot of surgical masks, any mask that is above 95%. But then the problem came where people just bought masks. They decided it was a good business to be in. So they started repackaging the mask. They get masks from China, perhaps, sent to Hong Kong, comes to Singapore, it gets repacked. The problem is that where we spend, and Singaporean sort of manufacturers, we spend a lot of money getting our products tested, having test reports, and we put it in our websites, of course. But the thing is that those products that actually get through from other sources end up in Singapore without any form of check. And I'm not saying that all of them are bad, but what happens to the quality assurance that you need? I mean, we're not talking about a problem with a single mask. Even in Surgisil, you will get some form of factory errors. It's inherent in any system, but the quality of the product still stays the same. What am I saying? If assuming you have a Singaporean product that has gone through the rigors of the HSA sort of examination standards, you're getting a product which will very likely protect you more than something which you do not know where the origin is. Because you've seen a Singaporean mask manufacturing company, which, as you know now, it wasn't manufacturing masks. They just got a box. They did FDA, CE labels, and these were not in any form of rigor in terms of what we have had to go through when we do the submissions for our CE mark or FDA clearance. So these boxes mean a lot. When you see a box and it says a CE mark, you assume that it's gone through a certain level of acceptance by the European standards and for the FDA, for example. But here you have marks that have been made and they've just been packed into boxes which have these markings, and people have been buying these blindly. And the most amazing thing, of course, is that they have repackaged into different brands, different packagings, so people think it's different. But unfortunately, as they say, for every product, there's usually a willing buyer. But I think being critical about this at this stage of time now, we know that for the foreseeable future, we will have to depend on a mask that can protect us. I personally find it very difficult to maintain the cloth mask that we have. I use it as a fashion accessory. I've taken a photograph and put it on Instagram. But on a daily basis, the Surgisil mask meets my sort of standards as a practicing dentist and as previously working as a medical doctor. I'm not here to tell you that this product is the best product in the world to use, as I said, but there needs to be clarity as to why this mask was created, what it can do, and certainly for those Singaporeans or those who are in Singapore, please be assured, if you have the product of Singapore logo, and this is something which has been already looked at by HSA and conforms to the standards that are from Singapore, you're generally looking at a very, very well-made product.
If you like today's video, then don't forget to share it with your family and friends. And please do subscribe to my channel, Something Interesting with Deepti. Like, share and comment as well. Next week, I am going to take you inside the manufacturing unit of Medi Dent International, where this 3-ply surgical mask is made. So stay tuned.